Okay, class, we're on the fourth lecture of the course. Last we spoke, I mentioned a little bit about making sure when you design a program for an athlete or client, it has to be balanced. The reason being, if the program isn't balanced, you can force there to be asymmetries in the body, in the movement pattern. Overdevelopment of one side of the body to the other, which can throw off postural alignment, which can lead to injury. The risk of injury is increased because with poor postural alignment and repetitive movements that enhance a dysfunction in the movement leads to a lack of neuromuscular control and increased damage to tissue, which can initiate the whole cumulative injury cycle. So think about walking down the street, you roll your ankle real bad, it hurts to put weight on it. So what do? You put more weight on the right leg, and then it's a little quick, shorter walking gait you have down the street. And you might notice after a while, your back starts to get tight, your shoulder and neck starts to injure, because now it starts to get a little uncomfortable, because now different muscles are being recruited and forced to fire when they shouldn't be. So they're not able to work as efficiently on their main purpose, their main job they're supposed to do in the beginning, because now they're taking up the load and slack for something else. So the cumulative injury cycle is simply this. There's, let's just say, blunt force trauma to your leg. Trauma occurs to the tissue, which will lead to inflammation of the tissue. This inflammation is the body's response to the damage. This is a form of an active response to what has occurred. In doing so, this now is going to limit the mobility and flexibility of the muscle. It increases tension because now it's trying to limit the amount of movement. More movement causes more damage to the tissue, so it's trying to limit that. So this causes not only the muscle to spasm, but muscles around to start to spasm, because now it's trying to take up the load for everything else. This leads to adhesions or knots or trigger points in the soft tissue of the area that's damaged and those around. These adhesions can reduce the elasticity of the muscle, causing a muscular imbalance or an altered length-tension relationship. This causes the muscles around and other sides of the body to compensate for this. So in order to successfully complete a movement, simple as a step forward, the primary movers involved in the movement are no longer being used. Now the secondary, more synergistic or assistance movement muscles are now taking on more primary muscle role. Let's take, for instance, having a tight hip flexor. As an athlete, student athlete in particular, we sit at a desk all day, we're studying all day in that seated position. You go out to practice, you're a little tight. It takes a while to get it loosened up, maybe not till midway through the warm-up is where you start to really feel it, if you warm up efficiently enough. Now let's say we're running, you're doing your sprints, conditioning early on in the beginning of practice. You feel that tightness. The glute isn't strong enough now because it's not used to having to deal with a tight hip flexor to get that full extension of the hip. When that happens, now it's having to depend a little bit more on the hamstring to help it out. So the hamstring's main function has helped cause flexion at the knee, but also helps in the deceleration and slowing down when running. Now, if it's trying to also help with the extension of the hip while slowing down, now the hamstring's taking on more than it's usually accustomed to. The hamstring's taking on more of the role of the primary mover. This puts it at greater risk for injury. This is where you can get that hamstring strain. So when a muscle is no longer doing its main job, what it was there to do, this is what puts the body at risk for injury. So when it comes to developing correctives, exercises to help improve movement again, there's a few things you have to take into account. What the injury was, how it's affecting the movement, whole laundry list of things you need to look into. But here's a way to simplify it. Look at the inhibition of the muscle, inhibiting the muscle, lengthening the muscle, activating the muscle that's been injured or that you need to start firing again to complete the movement properly, and then integrating it back into the movement. So the first phase 1 and 2 of our injury analysis, is addressing the overactive musculature and improving range of motion. Now, if you have a muscle that's always firing, not shutting off, it's going to impede your ability to move because it's not firing at the right time. When it should be shut off to allow the full range of flexibility to come back, it's not. So now you're trying to work against another force. One of the techniques for the first phase of inhibiting that muscle is through myofascial release. Might be familiar with the technique foam rolling, using a marathon stick like a rolling pin, deep tissue massage, breaking up the trigger points. What this does, it helps not only increase blood flow and circulation to the area, it helps break up the knots and tissues without adding additional strain to the already strained muscle. By breaking up the knots, you can improve muscle elasticity. So when we do stretch it, we're not going to be putting it under a greater amount of tension. When you develop knots, I want you to think of a rubber band. You cut a rubber band in half, say it's 7 inches long. Okay, you pull it to 10 inches, you have a set amount of tension on it. Reset, tie a knot in the middle of it. Now you stretch it out to the same 10 inches. It's the same distance, not much further, but now the rubber band has been shortened. So now the tension on it is a little bit higher. So a little bit more tension on the rubber band. So if you were to pull a little bit more, it's significantly more than the band without the knot in it. So that's the same kind of concept that happens when the muscle has a knot and now it's being forced to still perform normally. Now everything's thrown off. It might not be able to handle what's being asked to do. So by breaking up those knots and getting the muscle back into its original state is the first thing we need to do when it turns to turning off the muscle, getting it back to resting. By increasing circulation of blood to and from the muscle, this helps remove the waste products, but also get all the proteins and things there to help it recover. Myofascial release can improve rate of muscle contraction and range of motion, increase muscle elasticity, and improve response to the stretch of the muscle and the mechanism to muscle tension. In the lengthening techniques, there are 2 techniques we're going to focus on here. The static stretching and neuromuscular stretching. So static stretching is elongating a muscle to the end range of motion and holding it for a period of time. This improves the extensibility of the muscle and connective tissue, thus increasing range of motion. Now, I know some literature says, when you stretch in this way, you can lose force power development. That's only in the extreme cases where people are holding stretches for minutes, not seconds. So take that out of your head. Don't worry about it for right now. The other phase is neuromuscular stretching, or a more common way of stretching, proprioceptive neuromuscular facilitation, or PNF stretching. This is basically taking a muscle to the end range of motion, and while the muscle is being stretched, you're forcing it to contract. While it's contracting, it's tricking it into thinking now it's already at its end range of motion. And then when it relaxes, this moment right after it relaxes, the latency period, the muscle neuron excitability is greatly diminished. So it shuts off, and it allows you to push the muscle a little bit further past its normal range of motion. It's a trick. So you go from actively to passively stretching the muscle. So PNF stretching is taking the muscle to the end range of motion, forcing it to contract, shorten, and then the moment it releases, all the nerves and synapses and sensories are shutting off for a brief moment in time for you to stretch the muscle even further. This is a great stretch to help athletes who are tight, especially after practice. Not so much so before a game or a main competition event, to a degree. Some study feels it just puts the joints at a little bit more, not as stable, because it gives it a little bit more laxity around the joints and not holding it in place. So, key thing with stretching. A tight muscle cannot react properly to stress or speed changes. A relaxed muscle has increased circulation, which will help with short-term and long-term recovery. Following a workout is very good to stretch because not only is the muscle warm and more pliable, it can correct any little imbalances or tweaks or knots that may be developing based on the stresses you put on it. If you can correct them right off the get-go, it's not going to carry on to the following day and lead to those altered motor patterns that occur. the wrong muscles firing. Stretching should be used not to correct faulty movement patterns, but just to reduce the likelihood of faulty patterns developing. So at RYPT, or Reach Your Potential Training, where we work with young athletes. We encourage them prior to the training session to warm up and do some myofascial techniques, as in foam rolling, lacrosse ball rollouts for the calves and the feet, breaking up any knots from the training session beforehand. And then following our training, we do the same thing again. This just prevents any of those adhesions or the knots from developing and then getting bigger, 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 and then causing disruption in the firing and recruitment patternings of the muscle. Once phase 1 and 2, the muscle is no longer firing when it's not supposed to, and you've gotten it stretched out and back into its proper alignment, now we can start working the athlete back into a more active training and getting them back into the program itself. So phase 3 and 4 focus on reprogramming the neuromuscular system, re-educating the body more or less. Phase 3 is isolating the muscle itself. So the muscle that's been shut off, not firing, we have to work on that. Get it used to being reanimated again so it knows. So basically you're aware of it, you can feel it firing, but also the body knows what it's doing. I'll use this example later on, but I'll just address it now. You hurt yourself, you have knee issues because your quads and your hamstrings and glutes weren't firing properly. You get your knee back into working order, there's no more pain. Now we have to get back into our exercise routine. All right. So when we squat, the primary muscle involved in squatting is not just the legs, but the glutes. The glutes have to be firing in order to slow the descent, to then extend the hips, pull you back up. So one of the exercises you can do, or we've done, is hip lift with an abduction. So we're actively trying to fire the glutes. Once we've done a high volume of this, not heavy weight, we want to look for a burning sensation, get the muscle firing where you really feel it perking up. Once you've reanimated the tissue, you're ready to bring it back, and you're now able to add it into or incorporate more of a dynamic motion, so a squat. We try to incorporate into the program itself. You can do this as a part of the warm-up routine or in the lift itself. It's best to do one of these activated exercises prior to the main lift, so you're making sure you're firing all 8 cylinders, and it's the right all 8 cylinders. So here's a basic breakdown of our program. So we have 2 blocks, our A block and our B block. Our first block is more the explosive component, so we're working on our Olympic lifts. Our next block is going to be our power lift, so we're going to go into front squat. So as we're doing our hang snatch, we're also supersetting or doing a lift with it in between sets, more of an active recovery, is our isoband abduction. So here we have athletes laying on their back with a band around their knees. They perform a hip lift and they hold that the hip lift up. They hold it up the whole time. Now all they do is pull their knees out and in for X number of repetitions. Then they go back to the hang snatch and they do this over and over and over again. So what we're trying to do is wake up the glutes, get everything firing that needs to for the next lift being the front squat. Because we're going to need the butt to fire properly in order to get out of the pocket. If we get the glutes firing at the right time, the right muscles will work, and there will be less likelihood for the athlete to be injured doing this exercise. So activating the muscle is step 1. Now getting the muscle back into the more lifelike, real-life situation, dynamic movement. Total body exercises. Another example being, now that we've got the butt firing, the glutes firing, now we're putting them back into re-educating the body into the proper squatting depth. All right, so ball against the wall, athlete leans against the ball. Now we're having them sit down, squat down into a seated 90-degree position that we need them to be in. So now not only are we ensuring that there's no load on their back, and we're training them to go down the proper direction, the proper way by sitting the hips back down to the proper depth. And now this is going to increase the likelihood that the glutes are firing when they need to be. This enhances the functional capacity of the muscle system by improving neuromuscular control through various movement planes. So rather than just always working at the stationary glute abduction, now we're actually putting it into motion. So this is what the body needs. The body needs to move, but we have to make it move properly. Multi-joint movements improve coordination of the musculature and again re-educate the neuromuscular system. By involving low loads and controlled movement, not only is the subject or athlete going to feel more confident in performing the lift, it's going to prevent any recruitment of the wrong muscles from coming into play. Gradual progression is what needs to be. Just like when you're gradually increasing up to your 1 RM, you got to gradually increase, introduce yourself back into the training program. One other way to progress, rather than just increasing load, is now basis support. Going from performing exercises with 2 legs at an athletic position, hip width apart, right underneath your body, to now being in a staggered stance. Now you're incorporating a little bit more balance. Muscles are having to fire a different way. Changing resistance too, incorporating a band to the side, anything to just force your body to adapt. Instability, gradually, where it's not making major compensations, but slight, can help improve an athlete's performance and the rate in which they rehab. When we talk about progressions, the bigger way to look at it is, okay, at RIP, when we work to our power clean progression, we work from the top down. So we cadence off of a box, a 12-inch box. The weights sit up there, so now it's higher. So rather than the bar being on the floor, the bar is now more at knee height. From there, we cadence it out. Okay, set, pull. The next phase would be, okay, you're on the block clean. Now you just do it when you're ready. Then the third progression could be, we lower the weight all the way down to the floor. Now you're at the right, proper positioning. When we did it from a higher ground, now you're going to know how it should feel in the lower progression. Same thing with box squats. So first we need them to control the weight going down, so we do an eccentric focus with a pause. Then we take out the eccentric focus. Now we just know they know how to go down, they can control it. And then they go down, pause, hold it right there. Then the third and final phase is just down, up, doing the front squat itself. So you can progress a lift without actually increasing the weight and still make it as challenging on the athlete without sacrifice form, technique, and posture. One of the tools that's used is the functional movement screen. It was developed by Gray Cook, Lee Burton, and Keith Fields. These are three guys with 3 different backgrounds. One was a therapist, athletic trainer, and exercise physiologist. But it's funny, in our field, all 3 are working, striving to do the best thing, helping everyone achieve, top physical performance, perfection, staying on the field. So these 3 guys got together and developed this system in a way to assess asymmetries or movement patterns that may be the links to injury. Why do we want to do an assessment screening? Well, it's to identify asymmetries and dysfunction in the fundamental movement patterns. Asymmetries are a key thing for determining whether or not someone's prone for risk of injury. Like I said, asymmetries can throw the whole body out of whack and make the wrong muscles fire when they're not supposed to. Asymmetries are indicating weak links in the chain. If you can attack these first before anything else, the likelihood of injury is greatly reduced. So, injury risk. When an imbalance occurs, improper movement patterns are apparent. The body, rather than fix the injury, will end up trying to attempt to work with the injury. So mobile joints become stable joints become mobile joints. Earlier I mentioned right here, say you roll your ankle, okay? You're playing in a game, you get this ankle taped up. Now the ankle's not as mobile as it once was. So the body still needs that mobility back somehow. So now the knee is going to take on the role of the ankle. Maybe it's not as stable. Now you're going to depend on the knee to do a little bit more of the rotation and movement. And this could be where you have those ACL injuries or MCL tears or strains of the knee. Same thing up here. Now the hip, maybe because now this is mobile, this has to become stable. The hip locks up. Everything just throws out. This occurs, now this side of the body is having to compensate for that. So by compensating for weaknesses that occur on the top side of the body or lower down the chain of the body can lead to injury. Look at it this way, a car. Car gets a flat tire. You drive on it for a long time with a flat tire. The other rims are going to become misaligned. You take it to the shop. They get the tires all realigned. You drive out, it happens again. Those tires are going to keep doing that until you fix the source of the problem, which is that flat tire. You fix the flat, everything else here goes back to how it should be. Now, what the functional movement screening does is it provides strength and conditioning specialists with the method to evaluate movement patterns by training, executing and training. What its purpose is to place the individual into extreme positions where weaknesses and imbalances are noticeable, occur. This is helping us to see how stable, measure their stability or mobility of their joints. Many individuals who perform at very high levels during activities are unable to perform these tests, these simple movements. I was at Missouri. I had an athlete who could run a 4.5 40, squat 400 pounds, but they could not do a deep body weight squat with their butt down to their ankles without their arms falling forward and shifting their weight to their toes. But he was a great athlete. But he developed coping mechanisms, compensation ways to get around this. This guy also had a lot of injuries where his hamstrings were always pulled, ankles were rolled, shoulder impingement half the time. So something in his body was off because though he lacked the mobility, but he was a great athlete, a lot of things were stepping in that shouldn't be. So sacrificing efficient movements for inefficient ones is not the best approach. Compensation occurs when you have to compensate. You develop a more poor movement pattern, poor myomechanics, lead to injury. The FMS system consists of 7 simple tests. Remember, the FMS is not intended to diagnose problems, but rather demonstrate what the limitations or any asymmetries that are in the individual you are testing. It's a method to evaluate the basic movement abilities of the individual. Seven of the tests are the deep squat, the hurdle step, inline lunge, shoulder mobility test, active straight leg raise, trunk stability, push-up, and rotary stability. A lot of it is engaging the core, but also requiring movement and balance to occur. So here are the seven tests. We have our deep squatting. So the PVC overhead, the person squats down. Now, if they cannot perform this lift, the way we regress it, we put a board underneath their heels, so now they can shift a little bit on their toes, but forces them to sit their hips back onto their heels to get deeper into a squat. The next test is the stepping, the hurdle step. So set up a band, a little hurdle right here. The band's at knee height, right at the base of the patella. The athlete has to demonstrate good balance, stepping straight up and over, heel touches on the other side, and they bring it back in. The whole time, we're keeping themselves in straight alignment and the PVC straight, perpendicular, horizontal, parallel to the floor. The next is the inline lunge. So here, athletes are standing on a board which is raised about 2-3 inches off the ground, so it's already thrown off their whole equilibrium. Now they squat down, having to keep the PVC right along the back, as it is here, keeping upright posture and bringing their knee right down to the ground, right behind their heel. The other is a shoulder mobility test where they make a fist. They try to bring their hands as close together as they can without walking it up. The other is the leg raise, testing hamstring flexibility, where they start with the legs down, both feet straight, raise one leg up. And now with this test, it's interesting because you see the foot turning out, showing tightness or imperfections in the hip, or the heel not getting quite past the 90-degree mark. The push-up test is another interesting test. When it's executed, you can see a lot of things going wrong, where you see the shoulders go up, the hips stay down, the butt goes up, one side raised more so than the other. The rotary stability test is a challenging test, and there's been a few tests where I've actually seen anyone score 3 on these. Where it's supposed to be, you're in a plank position, like a table position, you extend your arm and leg out, and then you're supposed to bring them back together, elbow and knee touching, and place it back down on the ground without shifting. Doing it on one side is a hard way, but if usually most people can't do it on the one side, then it's opposite hand, opposite leg, extending out and pulling it. All these tests are just to put body into movement patterns that they've done, but pushing it to its limits by overreaching where they need to be. Remember, the FMS test is just comprised of 7 fundamental movement patterns that require a balance of mobility and stability. These movements are designed to provide observable performance and basic local motor, manipulative, and stabilizing movements. Basically, it's just supposed to bring out any weaknesses or imbalances that are present. When grading the person in the FMS, this is what it basically looks like. So you'll have a deep squat. They can score anywhere from a 0 to a 3. Hurdle step, now there's 2 scores for each because there's a left and right side. Inline lunge, shoulder, shoulder, shoulder. Everything's two-sided. So it's hard to see really an imbalance that occurs in the squat because it's just going down. But you can see, through the naked eye, you can see maybe the hip drop a little bit more here or there, but you can't grade it on this. But this is where you can't just base everything off of one exercise. You need to do everything all together. So if we're looking down this list right here, you see 2, 2, 2, 2, 2, a 2 and a 3, 1 and a 2, 2 and a 3, 2, 2, 2. All right, I'm sure most people think, oh, we got to get those up to 3s. Yes, but not necessarily. The first thing we need to do is look at these asymmetries that occur. See, we have right here a shoulder mobility test. All right, on his right side, he scored a 2. On his or her left side, scored a 1. Okay, so he has a little bit better range of motion on one side versus the other. Now, when you're scoring the FMS test, you take the lowest score and put it in. That's what we're going to tally. All right, so once we tally all these up, we'll get an end score. So this person scored a 13. Yeah, they scored a 2, but that's almost canceled out because they scored a 1. Okay, so of these two, you see 2 imbalances that occur. Now, it's funny. This imbalance of the inline lunge, that could be directly correlated to why he has poor shoulder mobility. If you fix one, you could fix the other. That's why when you do these tests, it's a good way to assess weaknesses or imbalances in the body, because by fixing one, you can indirectly maybe fix another. Same thing down here. Rotary stability, nice and balanced, 2, 2. It's not a 3, but he's 2. He's equal on both sides. But that's what we want to see, more balance than asymmetries. Now, when conducting the test, if anyone ever scores a 0 on the test, pain is present, test stops, you have to refer them to a specialist, a physical therapist, athletic trainer, or doctor. As I said, asymmetries, 3 to 1, mobility, stability, and balance. This is increasing the chance of injury because now you might have muscles firing or compensation type movements that are occurring to fix and adjust for any pain or weakness they may have. Asymmetries without ones, maybe just like a 3 or 2, still need to be addressed, because though they're still showing good mobility here, like the high level 3 and 2, still a risk for injury because there are some things that are affecting this imbalance. So that they still need to address. Bilateral scores, 2, 2, balanced. It's not adequate mobility or stability. There is still a risk present, but it's significantly less because at least it's balanced on both sides. So whenever it comes down to it, if you're looking at a program or this test and you're faced with a weakness, like a low score versus an asymmetry, an imbalance, your number one priority would be fixing the imbalance before you try to get the other score up. So if the deep squat you scored a 1, but here they had a 2 and a 3, yeah, these are good numbers, but we got to fix this before we can fix that. Fixing this can indirectly fix and maybe correct another pattern. Implementing correctives into your program is really up to you how you want to do it. So at our facility, at our programs, we incorporate some sort of correctives or muscle activation exercises prior to the big power lifts that we do. And then at the end, we conclude our programs with some assistance exercise, more isolated single joint movements. So say we did the hurdle raise. And that's the person stepping up over the step here. They score a 1. It's not the best. And this score was pretty low. Okay, working on improving the flexibility of the hamstrings can help this. So if we jump back forward to the improved performance on the test is one way to develop correctives. So focusing on the test is the milestone to implement it into your program. All right, active single leg raise with lowering progression. So here all I simply have is the athlete, or in this case myself, laying in the doorway, both legs straight. Keeping both legs as straight as you can, you'll want to lower that leg down, keeping everything in perfect alignment. Back flat on the floor, that knee straight, that knee straight. Some athletes might not be able to even go down this far, so you put an ottoman up so the leg goes down maybe to here. Once they've perfected that motion, then you progress it further, lowering it down. Eventually, maybe you get them all the way down to the floor, no issues. The shoulder mobility test I mentioned earlier, where we saw that big miss, that asymmetry. So we scored a 2 and a 1. Here's a simple test. Lay them flat on the floor, loosening up the thoracic spine. Great mobility in thoracic spine improves shoulder mobility. So laying flat on the ground, one shoulder is reaching up towards the ceiling, others reaching towards the wall. Hold that position while stretching out the rest of the back. Then releasing can allow there to be that release of the muscle fibers, pulling them back into alignment. It's just a few of many different techniques you can use or implement into your program. To summarize, the FMS locates body's weaknesses by putting it into by forcing it into extreme movement patterns, which can be improved through therapeutic exercises, site correctives. The FMS is not the only way to assess client or athlete's movement patterns. You can develop your own. This is just more the more familiar and more popular version that most people use. But it's your program. If you're looking to improve X, Y, and Z, you might have a different scheme. The best thing with the FMS is it's a good way to indicate whether or not, if you are already developing a program, you're happy with it. It's a good way to test to see where an athlete is in the beginning using your program and to see if those motor patterns or movement patterns have changed at the end of your program. FMS and movement screens are good for also tracking the progress of your program, not your athlete, but to see if your program is balanced or if it's causing any dysfunction in the athlete. Again, it's the number one thing, making sure the program is balanced. It's a way to track its effectiveness. I'm also going to put up a document on the FMS, which you should read, which will still be fair game for the quiz.